Hello, everyone. I'm Michael Puldy, CEO of Puldy Resiliency Partners, and I'd like to welcome you back to part 2 of our 4-part series, OSHA's COVID-19 in the Workplace, where we talk about guidance provided by OSHA to help companies protect their clients and employees in the workplace. And with me again is Michael Goldman, my colleague, Director of Occupational Safety and Health at Puldy Resiliency Partners. Mike is highly credentialed in various safety certifications as well as international ISO standards. Michael, welcome.
Morning.
Quick introduction to Puldy Resiliency Partners. Once again, our focus is all about improving a company's resiliency, and we do that through a format of guidelines, training, process procedures, audits, anything that we can do to help improve the way a company can respond and reduce the threats to their employees. We find a way to make that happen. And for companies that do get in trouble, we do work with OSHA to help reduce your fine, help mitigate the situation, and get you back on track so it's a comfortable, safe place for your employees and for your clients. So, Michael, what are we going to talk about today?
In the first section, we talked about what it takes to establish an effective program. So today we're going to pick up the ball from there, and we're going to talk about managing an ongoing program. And one of the places that I wanted to start is a little bit of a review from the first section is implementing controls. So we have to make sure that these controls are ongoing and are being upkept to maintain their effectiveness. So that we've implemented physical distancing. Everyone is staying at least the 6 feet apart. We've installed barriers where we need to. So that's typically going to be where we've got an interface between our employees and the public, where we're suppressing the spread of the hazard of COVID-19 by using face coverings. And that's something we're getting used to in virtually every walk of life. And if necessary, we've done an assessment and implemented the improvements in our ventilation system. And where required, we are going to use personal protective equipment, and we're providing the supplies necessary for good hygiene practices and performing routine cleaning and disinfections of the workplace. So when we look at the cleaning and disinfection, so we're going to do a little bit of a deeper dive here into this control method. One of the things that we're going to do is we're going to go a little bit above and beyond typical housekeeping, because as you know, we're dealing with a very potentially dangerous virus. So what things we may be required to do is if we have a potentially infected person, we're going to close that area and do enhanced cleaning, maybe more powerful disinfectants, and do a little bit of a deeper clean, maybe remove the furniture, get up underneath baseboards and areas like that. We're going to open outside doors and windows to increase our air ventilation in the work area. And we're going to wait as long as practical before cleaning or disinfecting, and 24 hours is optimal. And we may even vacuum the space with what's called a HEPA or a high efficiency particulate air filter. Those are usually effective with 99.9% of the particulates that a vacuum cleaner may clean up. And this is also going to put us in compliance with some other OSHA regulations. 29 CFR 1910-1200, which covers potential exposures to chemical and physical agents for employees, and 1910-132, 33, and 38, which are PPE required for handling cleaning chemicals. So basically what this is saying is this is going to come under the jurisdiction of your HAZCOM program. Okay, this is an item that confuses a lot of people. OSHA record keeping and OSHA reporting are two different items. And what OSHA is requiring you to do is keep records of COVID-19 infections and deaths. With record keeping, you're required to enter into your OSHA 300 log, and anyone that has more than 10 employees is going to be familiar with the 300 log. You're required to list everyone that required medical treatment above and beyond first aid. So if they left your premises saw a medical professional wound up with time away from work, restricted duty, or medical treatment beyond first aid, you're required to enter that into your OSHA 300 log. Where it may get tricky is it might get a little bit confusing with contact tracing. We may not know for sure that this person was exposed at work. But my advice is, when in doubt, go ahead and record it. With reporting, you're required to report to OSHA within 24 hours anytime you have a fatality or you have 3 people that were hospitalized for the same event. So it's certainly conceivable you could have 3 employees in the hospital at once because of exposure to COVID-19 in the workplace. God forbid, knock on wood, any of us have to deal with fatality. But anytime either of those 2 things happen, you're required to report it to OSHA within 24 hours. So reporting and recording are 2 different things, but you are required to do both. And several of the citations so far that have resulted in fines from OSHA dealt with record-keeping requirements as it relates to COVID-19. Next. Okay, vaccines. The guideline is not expecting you, OSHA's not expecting you to set up a vaccination station in your workplace. What they are expecting is that if your workers schedule a vaccination, they've got time off to go get it, so that you are fostering a workplace where vaccinations are encouraged and people are able to get them within a timely fashion at no cost. I think that the issue here would be you would have someone that would call OSHA, a disgruntled employee that would call OSHA and tell them, my boss is not letting me take the time to go get a vaccination. That would probably spark an inspection and potential fines if that turned out to be the case. So I think what OSHA is really looking for here is that we are giving our workers time and space and the support they need to get vaccinated. And also, we can't distinguish between workers who are vaccinated and workers who are not. That's spelled out. That's one of the bullet points in the guidelines, so that after somebody comes back to work and they're vaccinated, we're not going to treat them any different. So they're still required to comply with all of those control methods that we've already mentioned. So we're not going to have somebody say, well, I'm vaccinated, I'm not going to pay attention to social distancing, wearing a mask, or the other required PPE. They're still required. We're still required to enforce that part of the program where need be. So to summarize the management section, we're going to implement preventive controls just the same way we've talked about in both of these modules. We're frequently going to clean and disinfect. We're going to be diligent on record keeping and reporting, and we're going to discuss the vaccine with our workers and make sure that they have access to getting vaccinated.
Thanks, Michael. I think one of the key items here that we keep hitting on in terms of the program management is the importance of record keeping and the importance of documentation. And the reality is anytime you can automate or improve the efficiency in terms of how you can record and maintain documentation, especially if you have hundreds, if not thousands of employees, the better off you're going to be. And this is one of the reasons we really like Havrion's health and wellness solutions, including their thermal technologies, because it really does provide that level of automation and control and management that's automated and much easier to maintain and manage and organized versus manual record keeping. So let's listen to Havrion talk a little bit more about those technologies.
Thank you for that introduction, Michael. Hello, my name is Susan Grossweiler, and I'm the Operations and Program Director here at Havrion. We're very excited to be partnering with Puldy Resiliency Partners and to be able to support this 4-part series around OSHA's COVID-19 guidelines in the workplace. Havrion is focused on protecting life, and with our Protect suite of products, looks to provide innovative technology and solutions supporting active shooter, environmental, weather, fire, and health and wellness solutions within schools and businesses. In 2020, as you can imagine, the largest threat to public safety was COVID-19 and the concerns around wellness and safety to ourselves and others. And this concern has continued with us into 2021 and the current administration. In support, HAVRION's launched a wellness solution that goes beyond the scan. HAVRION's Detect thermal solution looks to join not just the scanning device to your environment, but to seamlessly support pre, during, and post-reporting and documentation aligned to COVID-19 guidelines and support of your customers' business needs. HAVRION excels at the real-time data convergence from one or multiple scanners that can be within one or multiple locations around the country, all driving data into a single cloud interface and management portal. We also provide the ability to configure multiple devices at once, saving you time. HAVRION is a SOC 2 Type 2 certified company focused on the security of our customers' data and the transmission of that data to our customers' record keeping and compliance. Our enterprise portal looks to make our customers' lives easier, providing the tools and support that they need to align, again, to those COVID-19 guidelines and their own health and wellness emergency plans. So HAVRION's portal ties directly into our thermal scanning devices powered by RichTech. Whether you're looking for a simple thermal scanning device or a more advanced unit supporting mask compliance, facial recognition, or even QR code survey integration, HAVRION provides solutions that can easily work within your environment. HAVRION can even build out custom API integrations to support your data collection from these devices and reporting needs within your customer. As you can see here, this is one of our thermal scanning devices where it provides the temperature. It also provides the color coding of red or green, depending on your pass and fail, as well as the facial recognition, even when a mask is on, to allow for those options that you've chosen in your configuration to be present on the screen. It is also an FDA and ADA compliant solution that we're providing with an IP65 rated medical grade material that these devices are made out of. One of the other great things about our thermal devices is that we've actually worked with our partner to build the thermal scanning device directly into the unit and not have it on top. So it actually can be used great in multiple environments, whether that's indoor, outdoor, or shaded or sunny areas. And like most thermal scanning units, right, it's going to detect that temperature within 3 seconds. You're going to be able to have an accuracy within 0.5, which is extremely important, right? You want to make sure you have the most accurate units out there on the market so that you don't have to be sending people home when it's not necessary, right? And then that ability to sort of maneuver those settings with configurability and sort of what that ideal temp default is right out of the box. So to really summarize, right? HAVRION goes beyond the scan, providing pre, during, and post health and wellness solutions for schools and facilities of any size. We drive multiple communication paths, supporting our customers' safety plans for protecting their students, employees, and guests. And HAVRION really looks to provide layers of protection and delivers a path to expand your solutions to protect life with our Protect suite of products. Those being Alert Mobile, Detect, and Connect with digital displays. If you'd like to learn more about those solutions, please reach out to us and we'll be happy to provide you a demo. And as always, HAVRION is here to support keeping communities safe. And we have a quick video to wrap up today's presentation.
Welcome to HAVRION Thermal Protect, powered by RichTech. It's no secret that our daily lives have been changed by the COVID-19 pandemic. It's affected the way we live, work, and do business. Business leaders should be asking themselves, are you properly communicating public health and safety guidelines throughout your organization? Do your employees, customers, and partners feel confident in how you are handling public health concerns? Are you able to provide thermal ID reads and notifications in a non-intrusive and discreet way? HAVRION Thermal Protect is a versatile, in-depth, and non-intrusive way to enhance safety and promote wellness in public spaces. Bringing together RichTech thermal scanning technology and HAVRION's unique platform, We can identify and check every person's temperature before they walk into any building or enclosed space, and rapidly provide instructions and messaging to them so they can move safely and confidently. HAVRION Thermal Protect is an ideal solution for schools, universities, restaurants, office buildings, shopping centers, hotels, and other public spaces. HAVRION Thermal Protect is a solution that gives you safety and confidence by inspiring workplace confidence and advanced data analytics to enhance the customer and user experience. Versatility and customization through advanced messaging options, settings, and a diverse lineup of mounting option taking into account wheelchair accessibility and people of all sizes. Speed and accuracy. With AI-driven technology, the solution providing a result in less than 3 seconds while accounting for mask compliance and facial recognition, and compliance and security. Adhering to HIPAA, ADA compliance, and FDA standards. Our solution is cloud-based with 3 levels of encryption with an easy user interface, allowing for multiple device management from single login. HAVRION Thermal Protect isn't just a thermal ID scanner. We go beyond the scan and beyond the typical use of digital displays to enable rapid response alerts that can protect life. Want to see Thermal Protect in action? Talk with one of our reps and schedule a demo today.
Thank you again for joining HAVRION and Puldy Resiliency Partners. We hope you enjoyed our video. During this 4-part series, we hope that you got all the information around OSHA's compliance for COVID-19 within the workplace. And if you need more, please contact HAVRION today to learn more about our thermal solutions and consulting support through Puldy Resiliency Partners. Thank you again for joining, and have a great day.